Hey, everybody, this is Trevor Crow. The show is Trevor and Friends. This is brought to you by myself today, trevorcrow.com. If you're struggling with mental health issues, you can give me a call. I do couples, individuals, and families. And yeah, this is just a rough time of year for a lot of people. So I'm here. Sitting with me today, right now, is Liz Gustafson. She's Connecticut Director of Reproductive Equity Now. Welcome, Liz.
Thank you so much for having me.
So great
It's
to
great
have
be
you.
here.
Now, Liz has a long history here in the state for fighting for reproductive health and rights. Talk to us. How did you get involved? Why is this important to you?
I started in 2018. We were formerly then NARAL Pro-Choice Connecticut and have since expanded and grown our size. We have a state, Connecticut State operation. We're also in Massachusetts and New Hampshire, and so we're state and regional. And this is also important to me because access to the full spectrum of reproductive health care, particularly abortion access, impacts everyone. I myself had a medication abortion in 2018, and 1 in 4 people in their reproductive lives will also have an abortion. So it impacts all of us.
Mm-hmm, mm-hmm. Incredibly important information, incredibly important part of what we need in policy that we need to protect and keep going. We had the fall of Dobbs, Roe v. Wade. So talk to us about what happened overall in the federal level.
So the overturning of Roe was a significant blow to the landscape of access. Now states have moved to restrict or entirely ban access to abortion, and that also highlights why our region, New England, is so critical in the landscape of access to the full spectrum of care. And so Connecticut has always been a leader in protecting and expanding access to reproductive health care, and so this moment really is not only the opportunity of our state, but the responsibility of our state to do absolutely everything we can to protect the care here within our state, but also ensure we can help those who may be traveling here to access care.
Incredibly key. We are the state, the number one state that put together the Reproductive Freedom Defense Act right after Roe fell or Roe was overturned. And I am so proud of our state that we have been the vanguard for this because so many other states have taken away this basic right to autonomy, bodily autonomy.
Absolutely.
And I don't know, I believe you're even more passionate than I about this because you work in it every single day. But I am so proud of Connecticut. Why do we need this regional kind of approach? Because the rest of the country, there's certainly just huge deserts where people cannot access care. So why do we need to really come together and sort of have this model?
I think the best way to explain it is here in New England, people travel across state lines every day for work, for leisure, but also to access healthcare. And also as advocates, we have always shared strategies across state lines. For example, Connecticut was the first state to pass a shield law in the Reproductive Freedom Defense Act in anticipation of the Dobbs decision. And our fellow New England states were quick to follow us after. So it is that regional strategy that is critical right now.
So one of the things that I think so many people do not understand what's so important about this shield law that we have that we got passed, I think it was 2022. And what it does is if you come from out of state to access abortion or any reproductive needs here, you're shielded. You cannot be prosecuted in a different state. Also, if you perform that, you are shielded, right?
Yes.
You cannot be sued by a state such as Texas.
Yes,
That has a total ban.
And we do have one more step that we do need to take to further bolster that shield law to protect all providers, including those who provide medication abortion across state lines. Because providers, regardless of what the federal government has or continues to attempt to do, have always shown up for patients, both here in Connecticut And there are providers who are willing to provide care across state lines. And so it is up to us to continue advocating to make sure that they are also protected.
So we're saying that policy-wise, the legislature needs to work on mifepristone. I'm not going to say
Mifepristone.
Mifepristone. Oh my gosh, this is a part of a medicated abortion.
Yes.
Right, and there are states that work to try to ban that. Correct.
Yes.
And are actually trying to sue providers that prescribe that and send it via mail to out of state.
So you might have seen in New York this happening in attempts to extradite and go after a provider who provided medication abortion across state lines. And as of last week, this has also happened in California as well. And because of both of those states' shield law, their governor's response was, we will not be extraditing this provider and we will protect them.
So important. It just I'm going to say that.
We could say Miffy.
Miffy.
That's what I call it.
It's important for abortion, but people, this is important for saving moms' lives when they're giving birth and they're possibly hemorrhaging. You need to have this on a crash cart. And a lot of these states are putting them behind locked doors, which actually causes women to bleed more and possibly die. So this is just ridiculous, awful, and terrible for people having babies.
Absolutely. At no point in pregnancy, because pregnancy in and of itself is complex, should the government be interfering with a provider's ability to care for their patient in front of them.
It's truly scary to me. Now, the other thing that I think, and I'm assuming you guys are thinking about this from the regional standpoint of we need to, provide this defended Reproductive Act, but we need providers to be trained in this. And one of the problems is all these other states that have banned it, these young training doctors, nurses, et cetera, are not learning how to do these procedures.
Yes. We are grateful for our partnerships with providers and those from teaching hospitals. We work very closely, particularly with Yukon Health and also ACOG as well in Connecticut, a broader REACH, who inform us about what is happening on the ground, both as practitioners and what they need, but also what their patients need. And that is absolutely something that is happening.
Quick question. Do you have state legislators that are willing to add this sort of codicil to the law about medical abortions? Is that in the works right now?
Can you be?
So we're trying to make sure that our Freedom Defense includes the medical abortion.
Yes, it did make it out of committee last session.
Okay.
But just in the end of session timing and all of that, it didn't make it over the final finish line into getting passed. So we are committed to making sure that happens this year.
Okay, that's great. Well, anybody who wants to talk to their state reps or their state senators and they care about this issue, please reach out to them and say you are very much in support of making sure that any provider of medical abortion is shielded by this law.
Yes, please.
Right. Yes, please.
Join us in our advocacy.
Right. So you guys also have created the CT Abortion Legal Hotline. Can you tell us about that? That's a brand new thing.
Yes. So just a little over a year ago, we launched our pro bono legal hotline in collaboration with the State Attorney General's Office, Attorney General Tong, as well as a number of law firms who are offering pro bono legal support. And that is a hotline available for any providers or patients and or helpers, such as abortion funds, regarding their legal right to obtain or provide care.
Very important. Okay. Anybody who's listening right now and has concerns about abortion, reproductive rights, just reproductive health care, which is just health care for people, shouldn't be crazy or insane to ask for that to be taken care of. How does anybody get in touch with you, help support you? Do you need funding? Like, what are the broad needs you have?
So we need folks. So what we do, we advocate to remove these policy barriers to accessing the full spectrum of reproductive health care. We activate coalition partners and providers and storytellers to join and strengthen our movement. So if folks are interested in doing that, we have our Abortion Access Advocates program that is a virtual monthly volunteer program, and each month is a different topic. We'll have some folks come in and present, but that's a really accessible way for people to get the tools that they need to be an advocate in their own communities and support those in their own networks. I think this moment really demands that all of us know where people can get care, know what resources are available, and how to support those that are seeking and providing this care. We should all look out for one another.
Love that. Okay, you can get involved. You can get involved with monthly meetings. You can advocate. You can get your community partners. The phone number that you can call is 833-309-6301.
Yes.
Correct?
Yes.
This is an incredibly important topic that unfortunately is getting kind of swallowed by all this other insane news that's going on out there between President Trump wanting to take over Greenland, taking the Venezuelan president out in the middle of the night. It goes, ICE has just killed a woman who was disrespectful. So we're in a time right now where I've actually recently read, I think it's 126 pages. The Heritage Foundation has written up a list of what they want to get rid of for basically women, from no-fault divorce to a total abortion ban, right?
And
I think they want to get rid of voting for women.
And going after contraceptive access to fertility care and treatment, and assisted reproductive technologies. And those are all things that we, alongside our coalition partners, are working to ensure that is protected here, but also expanded so that folks who face barriers to these essential resources and services are able to access the care that they need.
So important. So one of the questions is, somebody from another state that could be a long way away and may not be able to afford either the drive or the flight, et cetera. Is there ways for them to access some funds to come here?
So there's networks of both abortion funds, but also practical support organizations. So practical support is kind of everything outside of the healthcare itself. So transportation, childcare, travel, etc. There's national networks of that, and we do have an abortion fund here in the state of Connecticut, the REACH Fund. We are also incredibly proud and grateful for our state treasurer to set up the Safe Harbor account, and that will be funding for that practical support as well.
That is really cool. I am so glad to hear about that. So if you have friends in different states who do not have access to abortion care, they can get help.
Yes.
So how do they reach the REACH Fund or the Safe Harbor Act? Is it the Safe Harbor Act isn't is it funded yet, or no? It's in the process of being created.
It's in the process of being set up and enacted.
Still amazing and so important.
Yes, and if folks are looking for that financial support, the National Network of Abortion Funds is kind of the national network of funds. So if folks want to see what is available in their state outside of Connecticut, and then the REACH Fund is reachfundct.org.
Okay, so I have a question about data and traveling over state lines, and how we protect people, because your data is kind of everywhere. And if you're on one of these apps that tracks your menstrual cycle, right, that could be a dangerous situation for you if you live in a state that has a total abortion ban. In fact, is it Texas that's trying to, they're trying to put a woman in jail for killing her fetus? I can't even keep track of what these states are doing, but they're all just barbaric. So talk to me about data.
So data privacy is the more tech that spreads, the more concerns regarding our data and sensitive health information increase. And so I know there's been a lot of warranted conversations around automatic license plate readers and flock safety. So we are supporting the ACLU of Connecticut's calls to address the concerns around any information that is collected that might potentially be circumventing our SHIELD law, because these companies have contracts not only here in Connecticut, but from other states that have abortion bans and restrictions in place. So we just want to make sure that that data is fully protected, so it's not being exploited by anti-abortion extremists in other states.
That's actually bone chilling. It really is, especially if you have states that are prosecuting women who get abortions and could potentially put them in jail or kill them, right? You could. And are there any states that actually are asking for the death penalty in this case?
Yes.
Just think about that, people, just for a minute. Just let that sink in, that we're considering murdering women because somebody should have the right to a bodily autonomy, and for whatever reason does not have the bandwidth in their lives to support another child. And maybe there might be in a very domestic abusive relationship that, and by the way, this is one of the biggest reasons why women are killed by their domestic partners, is because they're pregnant and they cannot get abortions.
Ultimately, to that point, I think it's really important for folks to remember that no one should have to travel to get the essential care that they need from here in Connecticut or to here in Connecticut. People should be able to get the abortion care that they need and that they deserve in the communities that they call home, and also the kind of care that they envisioned for themselves, whether that's medication abortion or surgical abortion. I think that's a really important reminder for any of the listeners.
It's really something else that we've come to a place now in 2026 that we're really concerned about women actually making choices for their bodies, that they could be prosecuted for those choices in a very brutal way, right?
The criminalization of pregnancy outcomes has been an issue nationally for years, but it has absolutely increased since the fall of Roe.
Just think about that word, those words together. Criminalization of pregnancy outcomes. Anybody listening, please sit up and really think about this. Think about reproductive health care for those in your family, because we all have family members who need this. I mean, half of our population needs this care.
Yeah. And it's about, the if, when, how of people either wanting to start or grow their families in safe and healthy communities with dignity and compassion, not fear, not threat of criminalization, none of that.
It is really disgusting. I mean, this is the worst type of coercion, truly. So what is going to happen if we get a total national abortion ban?
I think that will be interesting, because in the overturning of Roe, in the Dobbs decision, they claimed it was up to the states.
That's right.
And so, caveat, not a lawyer myself, but it is up to the states. That's what they said. And so now states like Connecticut are doing everything we can to double down on defending and protecting access to care that is essential, that is normal, that is healthcare. And so I think it would be interesting to see how that would play out in the courts. But again, I do want to remind folks that they said it was up to the states. So ultimately, though, the way that these barriers and restrictions add up and compound on one another, they also act as a ban without there being an explicit ban. Because if you have to go over hurdle after hurdle after hurdle, that works as a ban.
Yeah. It's so difficult. But we have heard these words before, right? We've heard that's legal precedent. These Supreme Court justices who were interviewed prior to getting on the Supreme Court, I think 3 of them, Gorsuch, Amy Coney Barrett, at least 3 had Kavanaugh, all said this is settled law. Roe v. Wade is settled law, and they lied. They lied to the American public, they lied to Congress, and they absolutely had a different version or vision, and here we are. So when they say it's up to the states, there is no part of me that trusts that.
Yeah. And that's why we do what we do.
So just anybody listening to this conversation right now, if we elect a Republican governor, what is going to happen to reproductive rights in our state? Think about that very carefully, because Ryan Fazio voted against the Freedom Reproductive Defense Act. Right?
Yep.
How do you feel about that? I am very strong. This is an issue that we cannot jump over, gloss over, pretend that it is important.
Absolutely. I mean, Connecticut historically has had broad bipartisan support for access to reproductive health care. So now, this moment, everyone needs to make sure that they are following and contacting and engaging with their elected officials to make sure that that is the reality and that Connecticut will not be backing down.
Another issue, of course, is Planned Parenthood, which we have for decades really relied on to create not just abortion, but again, just basic health care, right? Mammograms, pelvic exams, et cetera, that we all need. We should be doing this, most of us past the age of 40, once a year, right? Are you going to be able to step in and help with some of that, support Planned Parenthood itself, help with clinics? Like, what level are you going to be involved?
So we advocate alongside providers, both Planned Parenthood as well as Hartford GYN Center, which is the state's only independent abortion provider, but as family planning providers and also as a safety net provider for a lot of people who are enrolled in Medicaid, i.e. Husky, here in Connecticut. We advocate alongside them to ensure that they have the funding and resources that they need to continue caring for their patients and keeping their doors open.
Have you seen any cuts to this funding, especially from the federal government, right, for any reproductive health care? I'm just assuming the answer is yes.
I mean, that HR 1 big bill, I'm going to hold out on the middle word because I don't know about that, but
big bad.
Yes. Bad.
How about barbaric?
Yes.
Bill.
Big barbaric bill.
Yeah. And $75 billion of our taxpayer dollars are funding this group of people called ICE, who are attacking, killing, actually hurting our citizens, mind you. And we're cutting reproductive health care. We're cutting SNAP benefits. We're cutting education funding. We're cutting research on so many levels, right?
Yes. In the fall legislative session that was held, that emergency session, there was funding that will be allocated to family planning providers. But we need to make sure that we're not just putting a Band-Aid on and responding to what the federal government is doing, but fully investing in the infrastructure of access to the full spectrum of reproductive health care so these providers can keep their doors open and caring for their patients. As a patient myself, from my routine GYN care to my abortion to my annual flu shot, I'm a patient. So
gotta be there. Okay, I would like anybody out there who really cares about this issue to get in touch, to donate, to invest in these efforts.
Yes.
How do people get in touch with you? How do they get involved, etc.?
So they could go to our website, reproductiveequitynow.org, and you'll see we have a Connecticut page that folks can contact us. They can also sign up to become an abortion access advocate. That is that volunteer program that we have, and also get updates on our upcoming legislative session that will be beginning February 4th. That's the Wednesday.
February 4th, I think so. Yeah.
And so during that, we do send out action alerts, ways for people to get involved, and also engage in public hearings, for example. And it is the People's House, so it's really important that folks either write testimony or come hang out with me at the Capitol and testify in person.
Love it.
It's really important for people's voices to be heard.
So it's very impactful. If you want to get involved, give this number a call, 833-309-6301. You can volunteer. Your voice can be heard. Your voice matters, and this issue matters to every single one of us. You're also having a gala. Is that correct?
Yes.
Uh-huh.
In April. That will be our annual gala. We will be giving out some awards. That is going to be in Boston. It's a fabulous event. It's a lot of fun. And we hope to see you there.
Oh, this sounds lovely. I'm looking for the invitation. Wait, what's the date again?
April 14th.
April 14th.
Yes.
That might be doable. Speaking of awards, you yourself have won a couple of awards. Talk to us. You've won the Ruth Bader Ginsburg Award for Connecticut Democrats during the 2021 Women's Leadership Awards. Very cool. Congratulations.
Thank you very much. Thank you.
Really good.
Yes, I was honored.
Yeah, that's beautiful. And what's next? What do you think if we get through this legislation this time around for 2026, and we get this piece in there about Medicaid people providing Medicaid abortions? What would your next prioritization be?
I mean, it's ongoing. It
Mm-hmm.
is not only passing legislation,
Mm-hmm.
but it's also making sure it's being implemented
Mm.
appropriately. So I do a lot of personal education in coalition with those seeking care and those providing care.
Mm-hmm.
But then also the ongoing priority of folks knowing what resources are available to them and
Mm-hmm.
how they can be a leader in their own community, and be a person that someone can go to, like, hey, do you know where the nearest clinic is, and knowing where to point them, or being someone who someone can go to when they're seeking care and offering compassionate support and supporting those in your life who are accessing care, and just being a daily advocate on behalf of reproductive equity.
I love that. So being a daily activist, right, for reproductive health care, and knowing that we have resources right here in our state. In fact, in the region, I believe Vermont does not have a full law yet. I was trying to look up the other states that you're working with. Is that correct? I think Massachusetts went right ahead and did pretty much the same shield law that we have.
Yes,
Is that
they
correct?
also have the protections for telehealth providers across state lines as well.
Okay, that's another thing.
Yes.
I hadn't even thought of that.
Hmm.
Right. All right. So we just have a couple minutes left. Is there kind of a couple last words you have and that you want to sort of give us a little boost of, like, we can get through this? The administration has other plans, but what can we do?
Again, I always like to remind people that abortion is common, it is normal, it is healthcare, and what is happening at the federal level, by anti-abortion extremists to attack abortion and the full spectrum of care, that impacts all of us. And with that said, there's a lot of us who are fighting back. There are storytellers willing to share their stories. There are legislators who are fighting to do what they can across the state to defend this access. And so there is a beacon of hope and light here in Connecticut and across the New England region, and we're not going anywhere.
We love that. Okay, we got to wrap the show up. This is Liz Gustafson with me, Connecticut Director of Reproductive Equity Now. Very important discussion. Everybody have a great week. This is Trevor Crow. The show is Trevor and Friends, and it's brought to you by me, trevorcrow.com. Everybody have a great and healthy week.